The truth about COVID-19 vaccines and heart health. Contrary to popular belief, it's not the COVID-19 vaccine that increases the risk of cardiovascular disease, but severe COVID-19 itself. This is according to Dr. Rajeev Jayadevan, the co-chairman of the National Indian Medical Association IMA COVID Task Force. In a conversation with Kavita Bareli Dutt, the convener of the research cell Kerala IMA, Dr. Jayadevan clarified that while there is no scientific evidence linking COVID-19 vaccines to sudden deaths, there is a clear connection between severe COVID-19 and an increased risk of cardiovascular issues in the months or years that follow. This is due to the damage COVID causes to the inner lining of blood vessels, which can later lead to heart attacks, strokes, or other vascular events. But here's where it gets controversial. Some have claimed that the hasty approval and distribution of COVID-19 vaccines may be responsible for over 20 apparent heart attack deaths in Hassan district. Let's delve into the facts. Firstly, it's important to note that sudden death in young adults is a well-known phenomenon that has been occurring long before the pandemic. The causes are diverse, ranging from heart attacks in older adults to inherited heart rhythm disorders and structural heart diseases like cardiomyopathy in younger individuals. Non-cardiac causes include stroke, infections, toxins, and pulmonary embolism. Without ascertaining a clear cause of the recent deaths, speculation is misleading and unscientific. So how safe are COVID-19 vaccines? The safety of COVID-19 vaccines has been demonstrated repeatedly through large studies in India and globally. While vaccines can cause mild side effects, such as fever, body aches, and pain at the injection site due to the activation of the immune system, specific vaccines have been found to have extremely rare side effects. For example, mRNA vaccines used in the US can cause myocarditis, particularly in young males, at a rate of about 1 in 37,000. Adenovirus vector vaccines can cause a rare condition called VITT, vaccine-induced immune thrombotic thrombocytopenia, with a frequency of about 1 in 50,000 to 100,000. Importantly, VITT typically occurs within 2 weeks of the first dose, not years later. But what explains the perceived rise in sudden heart attack deaths in India? Sudden cardiac deaths have always occurred across all adult age groups. However, with the widespread use of smartphones and social media, such incidents are now frequently recorded and shared virally, creating the impression that these events are more common. Most cardiologists agree there is no substantial increase. However, those who had COVID-19, especially before vaccines were available, do have a modestly increased risk of cardiovascular events. Debunking COVID vaccine myths. What's really behind sudden deaths? Drug use and binge drinking, not pandemic vaccines, have been linked to sudden deaths in India. Health Ministry, The Tribune. Home health, drug use and binge drinking, not COVID vaccines behind sudden deaths. Health Ministry. A study observed that receiving 2 doses of the vaccine reduced the risk of unexplained sudden death. New Delhi, updated at 9:05 p.m., June 25, 2025 at IST. Union Health Minister J.P. Nadda. File. While vaccination had no effect on heart attacks among young adults, an ICMR-NIE study found that family history of sudden death, binge drinking within 48 hours before death, and recreational drug use significantly increased the likelihood of unexplained sudden death. In a written response to the Lok Sabha, Nadda stated that the Health Ministry does not maintain cases of heart attacks. ICMR-NIE conducted a study titled Factors Associated with Unexplained Sudden Deaths Among Adults Aged 18 to 45 Years in India, a multicentric matched case control study, at 47 tertiary care hospitals across 19 states and union territories of India. The study analyzed 729 cases with disease and 2,962 controls without disease from October 2021, March 2023, revealing that 2 doses of the vaccine reduced the odds of unexplained sudden death. Nadda emphasized that the study showed no increase in risk for unexplained sudden deaths among young adults during the pandemic. Past hospitalizations, family history, and lifestyle behaviors contributed to the likelihood. The health minister also cited AIM's Delhi's collaboration with ICMR to determine common causes of sudden deaths in young adults. Early analysis of data from AIMS shows heart attacks or myocardial infarction remain the leading cause of sudden death. No major changes in causation were observed compared to previous years. Together, These studies provide a more comprehensive understanding of sudden, unexplained deaths in young adults. Nadda noted that while vaccination did not increase risks, underlying health issues, genetic predispositions, and risky lifestyles play a role in unexplained sudden deaths. Sudden deaths in India. Genetics and lifestyle, not COVID vaccine. Minister Nadda explains. Could it be that the sudden deaths we're seeing in India are more closely tied to genetics and lifestyle choices than to the COVID-19 vaccine? That's what India's Union Health Minister J.P. Nadda is suggesting. Speaking before Parliament on July 25th, Nadda emphasized that underlying health conditions and genetic factors play a crucial role in the rise of unexplained deaths across the country. Our research indicates that the COVID-19 vaccine does not seem to increase the risk of sudden death, he explained. Instead, it's pre-existing health issues, genetic predispositions, and risky behaviors that contribute significantly to these tragic events. Nadda backed up his statements with findings from the Indian Council of Medical Research, ICMR, the National Center for Disease Control, NCDC, and the All India Institute of Medical Sciences, AIIMS. The studies revealed that while past hospitalizations for COVID-19, a family history of sudden death, and certain lifestyle habits can heighten the risk, the vaccine itself does not appear to be a factor. Preliminary data from the AIMS-led study also showed that heart attacks, or myocardial infarctions, MIs, remain the primary cause of sudden death among young adults in India, a pattern that hasn't changed much since the pandemic began. But here's where it gets controversial. Some might argue that vaccines in general carry risks. What do you think? Is the public being adequately informed about all potential side effects? Or are we focusing too narrowly on the benefits? On a different note, the government provided an update on COVID-19 deaths in Parliament. Between April and July, 164 people lost their lives to the virus. According to Union Minister of State for Health and Family Welfare, Pratap Rao Yadav, there was a slight uptick in reported cases towards the end of May, but this declined sharply by mid-June. As of July 22nd, most of the reported deaths involve individuals with pre-existing health conditions. And this is the part most people miss. While the vaccine may not be a direct cause of sudden deaths, it's crucial to address the broader issues of public health and lifestyle. What steps can we take to reduce the incidence of heart disease and other preventable conditions? How can we support individuals and families dealing with the aftermath of sudden loss? These are important questions that warrant further discussion. What are your thoughts? Share your opinions in the comments below.